I first want to thank those of you who are joining us in person and those of you who are watching on live stream. We are going to have several remarks, but first I want to say thank you to our Lieutenant Governor, who is here, Bethany Hall-Long, who is a public health nurse and a professor of nursing, to share a few remarks. She'll have to leave quickly after this, but really appreciate her presence and leadership in this issue.
Thank you. Thank you, Dr. Walker. We appreciate you as well on the team. And I would like to say, on behalf of the state of the Delaware, to Representative Cook and Representative Mimi Brown, and to Congresswoman Blunt Rochester's staff who are here, it's an important day as we are able to hear for the public the plans that are in place. And I, as the Secretary and Dr. Rattay so indicated, have had the opportunity as a Lieutenant Governor, but as a public health nurse and a faculty who just came from teaching epidemiology this morning, have every bit of confidence in our hospital systems and particularly in the plan that the Department of Health and Social Services has. And I know that our governor and his team and all are very much committed to making sure that the plans that might be necessary are executed, and we want the confidence of our public to be reassured that we have that system in place should it be necessary. And so again, Dr. Walker, compliments to you and to the staff, and I look forward to hearing the rest of your message today as we answer any important questions that we might have. So thank you very much.
Thank you so much. Thank you, Lieutenant Governor. So again, my name is Dr. Odom Walker. I'm the Cabinet Secretary for the Delaware Department of Health and Social Services. We know that this collaboration amongst our department is very important right now to protect the public's health. And because this virus is new, we recognize that the public may be scared and have concerns. To help alleviate some of these fears, we will offer updates such as this one today to make sure that we can share information to the public in an ongoing way and help them understand what they can do to prepare. We also encourage people to get the latest Delaware updates at DHSS's coronavirus webpage. You can see the address here. It's de.gov/coronavirus. The most important thing to understand today is this. The risk for the average Delawarean and the average American remains low, and the public health response in Delaware and across our country is aggressive. With community transmission of the novel coronavirus on the West Coast, we must prepare to detect the introduction of this virus in Delaware and to reduce its potential impact and spread. We also know today there are things that every Delawarean can do to stay healthy, to reduce the burden on the healthcare system, and to prepare if community transmission happens. In a few minutes, Dr. Rattay and Dr. Dries will go into more details on those fronts. But before they speak, I want to offer a specific message to Delaware businesses. Now is the time for employers to review their plans to operate with adaptations such as telework and flexible sick leave policies, as well as how to respond if an employee does get sick. Most important, in the event of an outbreak locally, we will need employers to stress to their employees that they do not need to come to work when they are sick. We recognize this can be a very difficult ask, especially for small businesses and for employees whose paychecks depend on every hour that they do work. But by limiting public interaction of people who are sick, this will be an important mitigation strategy if community spread does occur in our state. In Delaware, the person leading our response to this emerging public health risk has done this before. In her first days on the job as Director of Public Health, she led Delaware's response to an outbreak of H1N1. She has led our preparedness efforts for Ebola and for Zika virus, and it is my pleasure to introduce Dr. Karyl Rattay, the Director of our Division of Public Health.
Thank you so much, Dr. Walker, and thank you, Lieutenant Governor Hall-Long. I really first want to start by thanking our key partners because everything we do in public health, but especially a response like this, our partners are so incredibly important. So Mary Fenimore and our colleagues at the Medical Society, thank you. Tim Gibbs and Dr. Omar Khan from the Delaware Public Health Association and Delaware Academy of Medicine, thank you. Wayne Smith, thank you so much for your partnership. Also, Susan Haberstroh, your partnership with the Department of Education and us is so key. And also, Director A.J. Schall, thank you so much for your partnership as the Director of DEMA. I spoke with members of the media last week, some of you in the room, after our Joint Finance Committee hearing about Delaware's readiness to address potential community spread of coronavirus in Delaware. And even since then, things have changed nationally and locally. Community spread is likely, and our efforts, where previously they were focused on containing the virus, now we are shifting to a focus on mitigating the impact of the virus when it does begin to spread in our community. Despite the increases seen in the United States, the immediate health risk from coronavirus disease remains low. There are no confirmed cases of COVID-19 in Delaware. As of today, we have 2 patients under investigation. You may recall we had previously 3 persons under investigation, or PUIs, and all 3 of those have tested negative. Here is what I can tell you about the 2 individuals that are currently under investigation. These 2 individuals are located in Kent County and had recent travel to a country under a travel alert. If they are confirmed positives, we will share where their travel was to. News as of today, the DPH laboratory is capable of conducting testing. So our 2 persons under investigation will be the first 2 tests for coronavirus that our lab in Delaware will be running. Let me speak for a minute about our monitoring guidance. As you may recall, we have for quite some time now been monitoring individuals who have entered our state who have been in mainland China for the previous 14 days. At this point, we are monitoring 36. We have monitored a total of 36 individuals. Currently, we are monitoring 14 individuals who have been in mainland China in the previous 14 days. These are individuals who are asymptomatic. That means they have no symptoms. But what that means when they are asked to be monitored is we reach out to them on a regular basis. We give them a kit and advice on how to monitor themselves for signs of infection. And they are to remain in their homes, so that means not go to school or work during that time period. And very importantly, they are to contact us if they have any symptoms consistent with coronavirus, like a fever or a cough or any shortness of breath. Now, with new countries who are seeing sustained transmission, our monitoring is being updated accordingly. So anyone who has returned from travel from a country with a level 2 or higher travel alert, which at this point includes, in addition to China, Italy, Japan, Iran, and South Korea. So if individuals have been in one of those countries within the previous 14 days, what they are to do when they return is they are given the request to contact the Division of Public Health, where then we begin to work with them in monitoring for the till 14 days after they have left the country of concern. Let's talk about community spread a little bit. We understand that the process or what it may take to limit community spread can become an inconvenience for individuals, but also employers and schools, universities, and others. Last week, we began sharing CDC's guidance for various audience in what should be done to prepare. They recommend schools review their infection prevention and control plans in the event that there is a local outbreak in the communities. Schools should be prepared to offer flexibility to student schedules and making up lost class time, and consider options like online or teleclasses. As Dr. Walker already mentioned, it's important for employers to begin thinking also about their infection control policies, what they would do if an employee is sick, but also very importantly, thinking about adaptations like telework and flexible sick leave policies. One of our priorities this week is reaching out in greater detail to employers statewide through the Chambers of Commerce. Let me talk for a minute about healthcare providers. Currently, all of our hospitals are reporting a high census of patients with influenza-like illnesses. Hospitals have implemented decompression strategies by adjusting visitor guidelines and using additional hospital space for overflow. And my guess is Dr. Dries is going to talk a little bit about this, as well as hospitals are also working on plans to conserve their personal protective equipment, or PPE. Currently, the Division of Public Health is providing some of our PPE stock for hospital training purposes. To that end, I want to make a comment about masks. We just want to make sure that folks out there know that wearing masks out there in the community is not necessary. In fact, there's no indication that wearing surgical masks can and is an effective prevention measure. Additionally, what it can do is take these masks out of the stock, which are needed for the healthcare system for other reasons. We have been holding frequent calls and conversations with our healthcare provider and other healthcare partners now for about 7 weeks. We want you to know that we so appreciate your partnership and your perspectives as the people on the front line battling this issue. Just last week, we shared the CDC's updated case definition for patients to consider testing infection prevention for infection prevention providers. We will continue to reach out. This week is going to be a big week for us in reaching out to a variety of different partners. Long-term care facilities, 24/7 facilities, residential settings, schools, healthcare providers, and others. We will continue to work with a variety of different partners to ensure that as this evolves, that all of our partners have the latest and the best information. Currently, we are dealing with a particularly serious flu season with over 5,000 cases and 11 deaths statewide. Everyday actions the public can take now to slow the spread of respiratory illnesses, including flu and/or coronavirus, are key. And of course, that includes covering your coughs and sneezes. Do not touch your face, eyes, mouth, or with unwashed hands. Stay home when you're sick and avoid other well people. Wash your hands frequently with soap and water or alcohol-based hand sanitizer. Frequently clean touch surfaces. And if you haven't already, please get your flu shot. So our recommendations and the number of persons we are monitoring, along with the patients under investigation, can be found on our website, which, as Dr. Walker mentioned, is de.gov/coronaviruses. Businesses, schools, medical providers, individuals, and community organizations can download our flyers and view the most current information. Additionally, because we are receiving so many questions about the coronavirus, DPH is planning to stand up a coronavirus call center this week. The call center will have trained staff to answer many questions, or will connect individuals with our epidemiologist for more in-depth questions. Training for the call center staff begins tomorrow, so as soon as we are ready to go, we will publish our coronavirus call center line. And I will be available to take questions later. But in closing, I would like to say this is a marathon and not a sprint. We are prepared to be in this for the long haul, and we'll continue to push out information as soon as it becomes available. Thank you all for your roles in getting this information out to the public. Next, it is my pleasure and privilege to get to introduce Dr. Marcy Dries, who's the Infection Prevention Officer and Health System Epidemiologist here at Christiana Care.
Thank you, Dr. Walker, Dr. Rattay, and thank you all for coming to Christiana Care today. Christiana Care is well prepared to meet the needs of our caregivers and our community related to emerging infections, including coronavirus. We work very closely with the Department of Health and Human Services as well as the Division of Public Health every day, and we really appreciate the additional support that we've gotten as this situation has developed. As we've responded to the emergence of this new virus, our first and foremost priority has been to keep our caregivers safe. Without them, we cannot care for our patients, we cannot care for our community. So to do that, we've expanded existing protocols, developed new protocols to screen patients upon entry to our health system and to provide guidance to our caregivers. We train our caregivers in accordance to CDC guidelines to identify risk, isolate patients suspected of coronavirus, don personal protective equipment to protect themselves, and engage our infection prevention staff, who I help to lead, for any assistance that they may need. Our hospitals are fully equipped for patients with coronavirus, including negative pressure rooms that are in line with CDC's recommended strategies to prevent spread. We want to reinforce the message by the Delaware Division of Public Health that the best way to prevent illness is to avoid being exposed to this virus. These actions that you can take to avoid being exposed are identical to those that we recommend every year for flu. Wash your hands, cover your cough, disinfect surfaces frequently, stay home from work, school, or other public areas if you are sick. We understand that many people in our community are worried and may want to be tested. We were very excited to learn today that the Delaware Public Health Laboratory is now able to test for this virus, which will certainly speed up turnaround time and giving people the answers that they need. However, this testing will still be restricted to those that meet the case definitions. And for the most part, this is related to travel, contact with a known case, or in some circumstances, very severe illness with no other risk factors. So for that reason, we recommend that for the general public who may have concerns to contact their primary care providers or other physicians, refer to the DPH website, which is on the screen right here, or the call center once that is stood up. We do recommend not using the emergency departments unless your symptoms require emergency care, so that we can provide the best care to the patients that do require the emergency department. We do want to remind Delawareans that they are far more susceptible to flu, which still remains very common, as Dr. Rattay has said. And as she also said, we encourage anyone who hasn't already to get their flu shot. It is not too late. So I'll now turn the podium back to Dr. Odom Walker.
Thank you, Dr. Dries, and thank you for your leadership to get accurate and helpful information out to the public. I'd now like to invite up AJ Shaw, the director of DEMA, to come up, whose partnership is really critical for us to be able to manage this outbreak.
Thank you, Dr. Rattay and Dr. Walker. I think we've heard the overwhelming theme of partnership today, and I think that's going to be what guides us through the next several months as we're dealing with this. Mid-January, we started holding calls with our public safety partners at both the county and municipal level almost on a weekly basis to do some preparation work for this. So we've been doing that for about 6 weeks. We are here to stand by and assist the Department of Health and Social Services as needed. We will be enhancing the State Emergency Operations Center to an enhanced level tomorrow and providing any services that are needed with both the state, local, and federal partners across the region. So with that, I told Dr. Walker I wouldn't take too much time, but we're happy to be here and happy to assist.
And thank you for your partnership. Thank you to the ongoing work between the Division of Public Health and DEMA. We really appreciate it. And our partners at the hospital level to make sure that we are prepared for anything that may come and may change. And we certainly are committed to getting information out on a regular basis so that the public is informed. But also, if you have questions, we will stand up a call center where people who have inquiries or questions about their risk may be able to reach out for additional information. This ends our press conference. We're happy to address any individual separate questions after this event today. Thank you so much.